Councilor Shutt to give the invocation, please.
Stand. Dear Heavenly Father, Lord, creator of all things, we thank you for this beautiful day you've given us today, Lord. We thank you for breath of life. Just pray that you would watch over our nation, Lord, watch over our people. We just pray that you would guide and bless our children and our elders, Lord. Just be with the leaders of all Indian nations and the leaders of the United States to make good decisions for our people, Lord. Just watch over this committee, help us to make good decisions, and give us traveling grace today. In Jesus' name, amen.
And next, we're to roll call. Please let us know you're here.
Bradley Cobb. Janelle Fulbright. Here. Bill Anglin. Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates. Here. Joe Crittenden.
Here.
Jody Fishinghawk. Here. Meredith Bailey. Here. John Garvin. Hannah Glory Jordan. Present. Curtis Snell.
Here.
Chris Soap.
Here.
David Thornton.
Present.
Kara Cowan Watts.
Honey,
We do have a quorum.
and Buell's here.
Yeah.
Next, I would entertain approval of the February 16th, 2010 regular session minutes. First and second, all in favor, say aye. Aye. Any opposed? And that passes. Next, we're to reports, and first in the Claremore Service Unit, George Valaire, you are the next contestant.
Thanks, sir. Good morning, everybody.
Good morning.
You should have my report in your packet. Our CT machine is up and running, doing well. We're working on a plan to change the way that outside clinics access that. Right now, maybe you may not know that patients going to the CT have been required in the past to go through our walk-in clinic and be referred from one of our docs there in the facility over to CT. That makes no sense to me whatsoever. It's just adding more work. It adds more work to our facility, and it makes things more time-consuming. And for the patient has to go see two docs to still get to the same point down the road. So we're working on getting a formalized process. I talked to Melissa about that, and to where they can be referred straight in from the outside clinics instead of having to go through our walk-in. That should make it a lot easier for them and simplify it for the patients. Our visits are up. We're still about $500,000 ahead of where we were last year on collections. As you notice, we're not quite getting 900 new patients a month. We're down to just under 500 new charts. So they're still piling in. The last time I checked, we averaged, we're between 13 and 15% of those patients with any type of resource. Right now we're sitting just below 100,000 on total user population. We have 13 to 15% of those with any type of resource, Medicare, Medicaid, or private insurance. So with that lower percentage, I actually think we're doing pretty good on our collections. Had our governing board meeting with the area office last week. That went well. Nothing major out of that. Any questions?
We have any questions? Yes, Councilor Buzzard.
George, you said that on the CT scan they were going to be referred to Claremore directly from the clinic. Does that include other appointments too? Or has it always been that way?
Now, for the CT that I was told in the past, and this was only for the CT, they were scheduled. They had to go through the walk-in to have one of our docs refer them to the CT, which makes no sense to me.
Right.
That makes our patient.
That makes sense to me too. But what I was asking, and I guess I wasn't not clear, is that one of our doctors from a clinic sends a person to Claremore Hospital. Do they still have to go through the walk-in for other things, such as gallbladder surgery or?
No. Now, I understand the surgery clinic is operated a little different right now, which is going to change here in the very near future. The way I understand it is, in the past, they've sent referrals to those surgeons, and the surgeons looked at them, and then they were the ones that set the appointments for these patients. That's going to change to where there's going to be one phone number to call If one of the outside clinics needs a surgery appointment, they can call and set an appointment, and then the patient, before they ever leave your facility, knows when that appointment is. That should simplify everything for them.
Okay, thank you.
Any more questions? That's it. Thank you.
Thank you.
Next, Cherokee National Health Services, Melissa Gower.
Good morning. I submitted a packet and will be glad to, a report, be glad to answer any questions if you have any. I was going through here to see what, if there was highlights. There's some information in your packet about the 2011 Indian Health Service budget request. We're working on that and trying to ensure that there's some increases in the Indian Health Service budget. If anybody has any questions, I'll be glad to try to answer those.
Counselor So.
Yeah, let's have a couple questions about the issues on the field. Do you have any advice or any updates on what kind of activities are going on in those cases?
Okay. I'm sorry Dr. Grimm's not here to give you medical advice, but I can tell you
Manage
what.
public.
Okay. Our clinic, our medical director at Nowata, Dr. Kruger, he's also board certified in emergency response and preparedness, so he's been, from Cherokee Nation standpoint, has been handling that issue and working with the school and the state health department and the IHS Tribal Epidemiology Center. We had to, you probably read in the paper that the clinic had some exposure, and so we had to keep the clinic late one night and give everybody prophylax and make sure that everybody was safe and that the issue was being handled properly. So Dr. Grimm and Dr. Kruger are very involved in staying on top of it and making sure that everything we need to do has been done.
What's I guess, I don't know if I'm using the right terminology, but the incubation period, or whatever, the exposure to the time frame that somebody might develop?
I don't know that.
Okay.
I can guess, but I'd rather not guess, but I can get that and send it out to you guys.
I just had a couple people inquire,
Okay.
and I don't know either, so
Okay, I'll get it.
thank you.
Is that it, Counsel?
Yes, sir, thank you.
Councilman Fulton, I believe.
Yeah, I don't really mean to be bragging, but is there any way that you could reevaluate the way that we get out prescriptions? And maybe have to hire another person in there to help put out prescriptions or something like that?
Yes.
It's really down at Redbird, it's a problem there.
Okay? Yes.
I mean, it's everywhere, it's not just Redbird,
And I'll go ahead and answer some of Janelle's questions too. She had some questions before the meeting. Sorry, I'm looking at my phone, but he just emailed me back, so I want to make sure I get it right. Currently at Salisaw, we have 3 staff positions and a supervisor. We've been operating with 2 pharmacists and a supervisor. And the 3rd position has been open since July. For some reason, Salisaw is a hard one to recruit for pharmacy. We don't have that problem in any of our other facilities except Salisaw. It kind of just goes in phases. I don't know what the issue is, but anyway, they interviewed yesterday and have found someone that they are excited about that has lots of experience. So we're in the process of trying to get that processed. So there will be a 4th position coming on there. So there's 3 staff pharmacists and 1 supervisor. I think that answers your question. So the other thing is that mail order update. Mail order equipment has been installed and staff trained at all sites except Salisaw, and that's because they were short a position and wanted to wait till they get them on, which will occur as soon as they had to order something for the computer system, and as soon as that comes in and is installed, then they'll do Salisaw. So within the next couple of weeks, Salisaw will be done. Muskogee, Stillwell, and Nowata are already mailing, and Jay and Salina is going to start in the next couple of weeks. They've got their equipment and been trained, and then Salisaw will get their equipment in a couple of weeks, and they'll be trained and start. So that'll help also. The other thing we've been evaluating is the possibility of, we want our pharmacists to work at the top end of their licensure and be able to do clinics and things. So the other thing we're evaluating right now is to open a centralized refill and mail order center so that we can pull all the refills and the mail order out of the facilities and do it one centralized place. Lots of people have done this lately, and it works out very good for the patients and for the facilities. So we're evaluating that right now and hope that we're going to be able to do that.
Well, the call-in is working real well, as far as I know.
So yeah, we're doing several things to try to.
It's doing real good. You know, it's, some of those people, they come in there and they're sick, and even if they're not, you know, they get their regular checkups, they get their medicine, and then they get their medicine the same day they get their checkup.
Right.
And, you know, you wait 3 hours, well, that's pretty rough, you know, and
So that'll help getting the fourth position filled at Salisaw too.
thank you.
You bet.
Councilman Buzzard.
Melissa, just a couple of comments. One is on the third-party collection. I see the FY10 is way ahead of some of the other collections. on third
I'm
party.
sorry, I can't.
The FY10 collections on third-party revenue is getting up there, a lot more than 09.
That's right.
And what do you attribute that to? Is it just
Well,
more interaction?
on the year to date,
Yeah,
probably one of the reasons that it's more is because if you remember last year, we weren't able to bill for Hastings until about February, or maybe even March, I think.
yeah.
And so year to date, that could be one of the variables in there. But I have looked
I was looking
at,
at just the clinics only. It didn't include Hastings. So
oh, okay.
that's still good. I'm not.
I think that, yeah, I've got it. I was just, George and I were talking earlier about the economy and if that had really affected our billing processes, and I said, you know, we run about between, before we assumed Hastings, we were running between 55 and 60% of our patients had a third-party payer for Cherokee Nation. Hastings was about 45 to 50, so it brought our overall down a little bit. I just think that, you know, we've just we're doing a very good job on identifying third party. We bought another clearinghouse system and put it at Hastings to, that you can go on when you're trying to register a patient and you can send it out to this clearinghouse and it'll tell you if they have a third party. So you catch those people that, you know, just sometimes forget or don't have their information with them, those kinds of things. So, you know, we've done a lot of things on third party to continue to work on it to try to make sure we implemented secondary insurance billing, which we hadn't done except up until at the end of last fiscal year. So that's probably helped some. You know, there's just a lot of variables.
Yeah,
but
I can see, well, you can see the difference. The other thing, that, and this is a comment, I guess more or less FYI, but I had a call from a couple of patients where they've gone to the clinic, and apparently the doctor, the provider felt like it was something that needed to be addressed now. They couldn't do it at the clinic, so they send this patients to, in this case, it was Grove Hospital. Well, what I understand that they do get clearance to pay the ambulance ride over there to the hospital from Claremore. This is from Jay. But the patient went there, but now the hospital is billing him. And he thought that, since they sent him here, that he was covered. But that's not the case, from what I understand. So, excuse me. So I guess I'd like to see us ensure that the provider or whoever sends them over there tells them, what they need to do. Some do and some don't. Most don't do that.
Well, what's supposed to happen, and, without the name, I can't verify that it did, but what should happen is that if the provider wants to refer the patient over,
That's the case.
then that the provider would say to the patient, when you leave my office, you need to go over to Contract Health. And they actually send them over there, and Contract Health sits down and explains all of that. Now,
Okay.
I'm not
Whether
going to
that's
say that
happened or not,
sometimes
I
that
don't
might not have happened
Okay.
for various reasons, but that's the process.
Okay. Well-
And we have an improvement team that's working in Contract Health now. And we have found some process issues, and we're working on those. We should see a big difference in June, and by the end of December, our whole plan will be implemented. So we have found some issues, mainly with payment,
Right.
and so we're going to get those all fixed.
Okay, well, I just want to bring that to your attention.
Okay.
So that's good for the process team to have.
Yeah.
Okay, thank you, Chair.
Councilor Jordan.
Melissa, how are we doing on getting the bids for the storage facility at Hastings and I believe it's going to be doctor's offices? Have we gotten to a point where that's been bid out yet?
Yeah, the warehouse facility and is one project. The second project is the renovation of ER and urgent care, OB, and expansion of the physical therapy building is another project. And the A&E has been awarded on both of those. They've been bid out and awarded.
Do you know who got those bids?
Let me think a second.
That's okay if you just want to email it.
The warehouse was engineering only, and it was like a CGE. It was initials. I think it was. I want to say CGE.
Do you know where they're out of?
I don't know. That would be procurement would have all that information. I don't know that. And the A&E for the renovation pieces is Seltzer Schaefer. I'm not sure how you say that. Seltzer Schaefer, I think it's called. I think they're out of Tulsa. I haven't actually met with them. Those just got awarded about 2 weeks ago. And so I think their first planning meetings are this Friday on those. So yeah, we're moving forward.
Kind of in the planning stages right now.
Well, planning as in it's the first meeting with the architect on, start looking at the space and redesigning it and getting that together. And then once those documents all get finished, then they'll have to bid out the putting up the metal type building for the warehouse. And then depending on what it is for the renovation, we may do that in-house, or if not, they'll have to bid it out.
Now, when we get done with all this, we're going to be able, I think, maybe to move more doctors to the medical part instead of, a lot of people are using drop-in and going to the same doctor every time. And I'm just wondering, were we going to be able to move some of those doctors where they'll have a regular group?
It'll be a start for that.
Okay.
What it'll be a start for, and it's not enough space to do it completely, but it'll be a start for implementing a family practice clinic at Hastings, which they don't have.
And how, do you have just a kind of a rough timetable of when that will occur? Because I had several.
Well, what I'd like to do, because I'm using carryover dollars to do it, is I'm pushing them to try to have it done by the end of the fiscal year. I think that's tight. We may have to carry it over and finish it, but we're going to have a good portion finished.
Well, that information's gotten around to the general public, so everybody's real excited about it. They're going to get a regular they'll just have one doctor and it'll be the same doctor every time.
I'm not sure that information is accurate,
It's out there though.
okay? But it will be a start toward that, okay? But I'm not gonna stand here and tell you that every patient in Hastings is gonna have a
No, not
regular
every
doctor.
patient, but
'Cause they have
I
a-
think there's a
But it
good
is-
number
but it is
that
a
go
start.
regularly that are thinking, hey, we might get us a regular doctor now.
It is a start to try to address some of that,
Yeah, thank you.
yes.
Is there any more questions? That's it. Old business, I see we have none. New business, I do not see any. Announcements, the next meeting is tentatively scheduled for Tuesday, April 13th at 11 a.m. Are there any more announcements? I would entertain a motion for adjournment. First and seconded, all those in favor? Any opposed? We are adjourned.